to the chat. What we will do is in follow-up to the symposium, we'll send out a Jamboard link that you all can add your whys to, whether you're physically here today or virtually here today. On that note, I thank each of you again for the opportunity to launch you into that activity and into this symposium. I am proud to have served this association and feel privileged to pass the baton to Miranda Smith, your current board chair.
First, I want to thank Teresa for sharing your story with us and for your service and dedication to AGO since its inception. I've been really inspired by you and your leadership. And you're going to be missed, although we're very happy that you're taking a well-deserved break. So thank you, Teresa. Hello, everyone. I'm Miranda Smith, and I'm the current board chair of the Association of Gleaning Organizations. I first got involved in gleaning recently in 2020 when I moved back to my hometown of Seattle. My partner and I both had dreams of working for gleaning organizations to pursue our interests in agriculture, environmentalism, and social justice. I started working for a nonprofit meals provider, running their gleaning program at a handful of nearby farms. I loved being outside in the fields, learning about Washington state agriculture and trying different fruits and vegetables, and helping to provide fresh, local produce for the community. But what really kept me in gleaning and what keeps me involved still is a sense of community. The community of gardeners and farmers who are invested in providing food for those who need it. The community of amazing organizations and grassroots movements who fight tirelessly for food justice. The community of dedicated volunteers who make miracles happen. And of course, the community that is the Association of Gleaning Organizations, who have helped and inspired me so much along the way. This sense of community inspired me to join the AGO board and later to step into the position of board chair to further nourish these connections with like-minded folks across the country and help cultivate and grow this network to multiply our impacts. We are a community with so much to learn from one another and much stronger together than apart. So I invite you to set an intention with me of truly connecting with one another over the next few days. This might have started last night during bingo or the freaky fruit ball, but don't let it end there. Maybe step outside the comfort zone that is your organization or your region and start a conversation with a new person who might be from a different geographic area or with a totally different background than you. Sit with someone new at lunch. If you're joining virtually, stay on during lunch to connect with your fellow participants. Share your why of why you glean and ask others for theirs. Even if you know them, their answers might surprise you. Connect with our various knowledgeable speakers, ask questions, and participate. Make the most of this short time we have together and the vast knowledge and experience we have together in this room. And with that, I'd like to officially welcome you all to the 6th Annual Association of Gleaning Organizations Symposium. Thank you so much to our gracious host, Tikkun Ha'ir, for welcoming us to Milwaukee and making this all possible. There they are. Thank you, Sean and Kathy. Thank you, Sean and Kathy, for your invaluable work organizing this amazing event. And now it's my pleasure to introduce our keynote speaker, Raina Andrews. Raina Andrews is a public health ambassador, author, and activist with her core work in food security. Raina is the founder of the Healthy Food Movement, a wellness company focused on food security and food literacy in underserved communities. She is helping to change the narrative around food insecurity through education, literacy, and community engagement. Raina is the host of the local radio show, Our Community, Our Health, where she brings clarity to our healthcare system and always marries the intersectionality of food. Raina is also the author of the children's book, Alex McGreen and the Tale of the Mysterious Tale. And you will be able to purchase a copy at the presenter table during your lunch break. Let's give a warm Ago welcome to Raina Andrews.
Thank you for that warm welcome and introduction. How's everyone doing?
Great.
Everyone's feeling good? Does this feel like home?
Yeah.
Not really, because if you're from a warmer place, you're like, not really. But I asked that because we all have something in common. Today, the message is really going to be about relationship and how we're connected to one another. And so in the introduction, I'm known as a food activist. I'm known as a hunger fighter. I'm known as an author, a TEDx speaker, a sister, a daughter. But what I'm most proud of and what I'm grounded in my why is that I'm a proud mother of a 5-year-old little boy who refers to himself as an engineer named Julian. And I'm just thinking about my journey, and I want to start off by thanking Sean and Kathy. You guys have done a masterful job in organizing and coordinating this. But to my longtime dear friend, Sammy, thank you for thinking of me and inviting me to this opportunity. And so today, I'm just going to talk about my story and my truth. Nothing that I say today is absolute, but it's what I know to be true from my lived experience. And so in my introduction, as you said, I am the founder of the Healthy Food Movement, which is a wellness company focused on food literacy and food security in underserved communities. I've been in this food space for nearly a decade now. What inspired me to write my children's books is working for Wisconsin's largest food banking system, taking up eastern Wisconsin, 32 counties, serving 600 food pantries, meal programs, and shelters. And at the very beginning of that, I was so passionate. I felt like we're doing the good work, we're doing the necessary work. And knowing the story, particularly of the food bank that I worked for, it started as a community project started by the Rotary Club of Milwaukee. They started gleaning bushels of apples and giving them to the neighbors in need. They were doing direct service, but then they grew bigger and bigger and bigger, like many affiliate and national organizations. And they started distributing to networks of food pantries, meal programs, and shelters instead of their neighbors. And what I realized is that they began to become a disconnect between what the neighbors really needed and what the network really needed. And so it shifted from moving to a transaction rather than a relationship. And so today the message is really about relationships in the context of our relationship to the food that we glean, that we distribute, how it impacts the people that we distribute it to, our end users. We're going to talk about systems, how we create these powerful systems of change, not missing the piece that we play and the piece that the coordinated pieces, the other networks need to play in this. It's not just about gleaning. It's not just about hunger. We're also going to talk about community. What systems and how can we work collaboratively with other communities to move the narrative forward? And so I also have the pleasure of working for an amazing organization called Food for Health. Have any of you ever heard of Food for Health? Some of you. It's a popular name, but Food for Health, we've been around for a little under 5 years. It's a social enterprise focused on managing, reversing, and preventing chronic illness through medically tailored meals. Transitioning from food banking into food as medicine has been an eye-opener. Because in food banking, we did great work. It was pounds in and pounds out. But then I realized that it's not about pounds. It's not about food. It's about the nourishment. It's about the quality. It's about the impact. And it's about truly feeding our neighbors. And so when I joined Food for Health, I was very happy, and I'm still happy with the Healthy Food Movement. I do consulting. I do the racial wealth gap. I do my children's books. But really the focus is on carrying the message that we are in a crisis as Americans. You know, when the question was asked about connectivity and why we do this, the reason why I do this is that 1 in 7 households in America don't have enough food to eat. 1 in 4 in Wisconsin, particularly in the city of Milwaukee, where children are present, don't know where their next meal is going to come from. And so the reason why I do this is, for me, it's not just about food. we are experiencing a serious nutrition crisis in America. It's not that there's not enough food going around. We have a logistics problem. We have a transportation problem. We have a nutrition issue. And so I want to go through what the challenge is. From the macro, we're experiencing chronic disease has caused a health crisis where 60% of Americans have at least one chronic disease. When I talk about chronic disease, it's type 2 diabetes, hypertension, cardiovascular disease, even obesity. Does anyone know anyone with one of these diseases? Nearly all of us. For you guys in Zoom land, nearly everyone raised their hand. It's draining society and killing our families, where 85% of US healthcare expenditures are spent on chronic disease. We spend trillions of dollars on healthcare. It's hurting the ones with lowest income. When you look at those who have been underinvested in, I hate saying poor communities, that have been underinvested in, compared to those with means, they're 74 times more likely to have some kind of chronic illness. And then when you think about that it's just for our most vulnerable population, think about employment in workplace settings. It's in crippling employers, where 87% of employers believe that the cost of providing health benefits will become unsustainable in the next 5 to 10 years. And it's burning employees. Can you imagine 75% of the workforce reporting that they have some type of challenge, health challenge outside work? What does this mean for us as a people? What does this mean as a community? What does this mean as a workforce? And the most painful thing is that diet-related disease is preventable. I'm just gonna make a mess. So in perspective, why is this a challenge, Raina? Why are you so worked up about this? In perspective, the graphic to the left of the chart, it shows that we've had a 20% increase in spending over the last, over the last 20 years. But this chart, I really want you to take a look at, because for those of you in the back who can't see, at the top in black writing are all the countries that invest far less than us, are outliving us. We have a severe life expectancy decrease where we're not only spending more, meaning when you go this way, you're spending more, but the average age here is 79. That's a problem. Because, I mean, if we're spending more, we would think that we have better care, we have better outcomes, but we're not. As a matter of fact, in Milwaukee, you have neighborhoods where there's a 10-year life expectancy gap from one side of the street to the next. Thank you. We've created this vicious cycle. How did you, our products in the 80s? Maybe 90s? Well, in the 80s, you had a lot of movements that rose up. You had the boy bands and the girl bands, right? You also had the rise of fast food and microwaves, the quick society, TV dinners. You also had the war on drugs. You also had the war on poverty. And I'll share in just a second why that context matters. But today what we're experiencing is this vicious cycle that started long before. To the left, the bottom left of the graph shows record-breaking profits for the food industry. To your right, it shows record-breaking profits in healthcare. And in the middle, it shows that we're more focused on treatment and pharma than we are on the root of it, which is our food. And so, if you haven't gotten it by now, I'm trying to tell you that our food is killing us. Can some of you kind of identify with this? Are you tracking? And so when you look at sodium, processed foods, sugary foods, it's in everything. People are dying at alarming rates. We spend billions and trillions of dollars, and it continues to grow. And when you think about it, right here in Wisconsin, right here in our backyard, the problem is even worse. Preventable disease has caused 35% of deaths in Wisconsin annually and is the leading cause of death in the state. It is the leading cause, not gun violence, not drugs, not opioid addictions. It is preventable diet-related disease. So if you're wondering about your why in distributing healthy, safe food and why that's important, it's because we're in the middle of a crisis. It's costing us 65% of Wisconsin residents either are diabetic, pre-diabetic, or yet to be diagnosed. And when you think about our social safety net, like Badger Care, Medicaid, we spend $1.15 billion with a B just on pharma spend. So if it's not touching you, you know, people like to react as an innocent bystander. If you're like, well, you know, it's not me, it's my neighbor, it's going to hit you financially. So it should affect all of us. And for the vulnerable populations that we say we're in this to serve, they're 9 times more likely to experience some type of nutrient deficit that has them not only being food insecure, but not only being able to afford the medical bills that are caused by them having some type of illness. And so, how many of you are familiar with food as medicine? So, food as medicine is important to mention, and a lot of people are familiar with it. It became quite popularized by the White House Conference on Food, Nutrition, and Health. Were any of you there? Mm-hmm. It was this past fall, the last time we had such a conference was in 1969, and out of that conference came SNAP and WIC, and many of you have big eyes because I wasn't even around back in 1969, okay? And so I want to just share that food as medicine is a concept that's been around since the beginning of time. But most recently, it's become really popular, and it became highly popularized in the 80s, and it's coming back around again with a whole new movement from the lens of policy. So one thing, it's from concept and practice. Now we're moving to supply chain. And so truly, food as medicine is a movement which is rooted in the idea that the food we eat can have a significant impact on our health, and a well-balanced diet can help prevent and manage chronic disease. How many of you believe this to be true? So all of us, well, most of us, I can see. So I want to point out one of the pioneers, and I want to distinctively say one of the pioneers because there have been so many forefathers that have come and foremothers who have come in this food as medicine movement. But I want to point out Dr. Andrew Will. He is, he's a doctor. He is one of our earliest pioneers, and he's the one who introduced the concept of integrative medicine. Integrative medicine is not traditional medicine where they provide a prescription drug. It's really looking at holistic care and holistic wellness. How does food intersect with our well-being and quality of life? He is mainly the author attributed to that. And Dr. Will was able to open up the first integrative medicine program at the University of Arizona. Why this is so significant is that the University of Arizona was one of the first institutions to start teaching doctors how to look at holistic medicine. So instead of writing prescriptions, to look at the wholeness and well-being of individuals receiving care. And in 1993, the Food as Medicine Institute was founded. It's a nonprofit organization in North Carolina. Are you guys familiar with that? It's an organization, I see your head nodding. It's a nonprofit organization that not only teaches practitioners that food is medicine and food literacy, but they also teach community members how to spread the good word of food as medicine from a grassroots perspective. And so throughout time, there have been different movements to come up. But one that I really want to point to is the Food as Medicine Coalition. Are you familiar with that organization? The Food as Medicine Coalition was born out of the 1980s. And a number of the members who popped up across the country popped up in response to the AIDS pandemic, where AIDS first came up, and before we had advancements, there was wasting syndrome. And so they would provide nourishing meals when there were no other resources to care and love on our neighbors living with AIDS. Now that there are advancements, the technology and the relationship to food has evolved to now care for a number of illnesses, such as cancer, type 2 diabetes, cardiovascular disease, and even renal failure. And so the Food as Medicine Coalition is a network of medically tailored meal providers across the country. You may have prepared meals, you may have frozen meals, you'll have prescription RX, veggie RX, you might have heard of these. That is the Food as Medicine Coalition. It's a network of certified practitioners across the country, some who have been doing this for 30 years, but really there's a foundation on what it means to distribute medically tailored meals. Like I mentioned, since the White House conference this fall, people have been popping up saying, I'm food as medicine, I distribute medically tailored meals. But I just want to take a second to define what it means to be a medically tailored meal provider. Medically tailored meals are seen as truly a medical intervention. where you have registered dietitian nutritionists and culinary staff come together to create nutritional profiles specifically designed for that disease state. So you have nutrition guidelines specifically for diabetes, hypertension, cardiovascular disease, renal failure, cancer, HIV, so on. You also have to be a nonprofit organization focused on our most vulnerable communities, which you all are. And you also need to focus on more than 3 illnesses to be able to reach the masses, and you have to be free to those most vulnerable and truly needy. And so I wanted to share from a national food as medicine coalition some of their top priorities. And I'm sharing this as points of inspiration. As we're growing, as we're developing, as we're looking for opportunities to connect, the Food as Medicine Coalition is not just about food. Just like you all cannot just be about food if you wish to top hunger and to really solve some of the other social challenges that exist. And so the first thing that they're focused on is advancing equity. Who knows what equity is? How can we define equity in this room?
Everyone gets the same share.
Everyone gets the same share. Are there any other thoughts?
Same. Going back to that kind of that illustration we were having. So if it's a person of less height, there's 3 people looking over a fence, and you make a person with all the same boxes that but equity is making sure everyone has a box that gives them the same line of sight.
Bingo. It's leveling the playing field. Because when you think about the racial wealth gap that exists in America, how many of you believe there's a racial wealth gap that exists? Okay, so it's not, we don't have to debate that in this room, right? There's a racial wealth gap that exists that has, even in a state of poverty, some people, due to their race, due to their socioeconomic status, still do not have the opportunity as others. As a matter of fact, even for those who are below the federal poverty limit of $25,000, those people of color, particularly African Americans, to their $1, a white American has $13. That's just how disparaging that wealth gap is. And so when I talk about this issue of food, it's not just about food. We're talking about a complex issue of poverty, because people don't just wake up hungry, right? And so specifically, the Food as Medicine Coalition, their national priorities are advancing equity. Right now, we're defining what does equity mean for us, because we could have gone around the room and we could have gotten a lot of different definitions. But we're looking at what is equity in the space of health equity, and understanding what are we dealing with, who are we dealing with, and what are the disparities that they're facing, so that we can meet them where they are and not providing everyone with the same thing. The second thing is building the capacity. So as you saw on the map, there's about maybe half of the network highlighted in green. Those are all of the states that currently have a food as medicine provider in that state. And they're constantly growing. That map probably could have been updated and included 5 additional states. But in building the capacity, it's making sure that your network not only has the resources, you're speaking the same language, you're providing the same services, but that you're contributing to a groundswell of evidence that medically tailored meals not only manages and prevents, but is able to demonstrate a reversal of chronic disease. And when I say reversal, I'm not saying medically tailored meals will reverse HIV. It won't reverse cancer, but it can help with the symptoms that come from having a compromised immune system. And in cases like type 2 diabetes and hypertension, that can be reversed by the diet that you eat. And finally, strengthen policy and the advocacy. This is huge, because in this network, a number of us are fighting for resources. How many of you really got to expand during the pandemic? How many of you benefited from ARPA? A lot, right? Hands shot up, right? But all we know is that those resources are drying up. And I don't know about you, but having worked in the food system for nearly a decade, there's almost like these fiefdoms where we're competing for resources. And so in this, we're focused on systemically, as a system, how are we looking at this so that we're not beholden to philanthropy? So we're not beholden to ARPA. So we're not beholden to national disasters that bring in influxes of resources for social services organizations. So what we're focusing on is reimbursement. Because we are a medical intervention, we have hospitals working with us, insurers, community-based organizations, federally qualified health centers, we've been able to demonstrate what pharma has not been able to demonstrate. And so at a national level, on the federal, state, and local, we're working in concert to be speaking to our governors in our respective states, our senators, our Congress representatives. And what's happening is that we're also advising Medicaid directors on how things should be shaped to provide quality care for people on the front line, the people that we're serving. So what this looks like are 1115 waivers. How many of you know what that is? Have you ever heard of this? So in medically tailored meals, an 1115 waiver is allowing doctors to write food prescriptions and having the food that we deliver to the doorstep of that person in need to be paid for. You also have in lieu of service. So instead of coding it as something, as one thing, you can code it as something else and still be reimbursed for it. We're also looking for NIH funding to do demonstration projects to continue to demonstrate that food is medicine. We're currently working with the Harvard Center for Health Law and Policy Institute. And what they're focused on is creating a groundswell of data to demonstrate how medically tailored meals not only is effective, but also substantially decreases the cost of care. And so community. In 2016, thank you, Elena. Earlier on, she came up to me and she's listened to my TEDx. I did a TEDx called Food Insecurity as a Public Health Concern. This is a vanity. I'm just wondering how many of you are familiar with this. Some of you have watched it. And so what I talk about is my very personal journey of experiencing hunger myself. And if you've ever experienced hunger, it's almost like, have you gone out to dinner and the food was taking too long? So you're hungry and you become angry, and so you become hangry, right? It's almost like coupling that with not knowing and the anxiety of not knowing when you're going to eat again. And that's exactly what I was experiencing. And so at first I thought I was going to come into this just talking about my experience in food banking and the wonderful stuff that we were doing, because this is at the very beginning of me starting to work for the food bank. And then the 8 weeks of preparation. Has anyone here ever done a TED Talk or a TEDx? It's 8 grueling weeks where you think you got it, and they're like, no, dig deeper. I got it. No, dig deeper. And I was not planning, for those of you who thought, I was not planning to share all my business. Okay? I mean, you guys don't see it. I'm grown now, but seriously, it was a very humbling experience. And what it did is it got me rooted to my why. And it's like, oh my goodness, because of shame of being on food assistance, because of the years of saying it's bad and wrong, because of the narrative of what's wrong with you, why can't you just pick yourself up by your bootstraps, that I realized that I had buried that side of me. I was so humiliated. But over the years, I was able to realize that it's not us. And it can't be them versus us. Like, it can't be us as in the vulnerable population. You can't put it on them that the mother, Nikki, who's a single mother, she has 3 children, she works 3 jobs trying to figure out how to put food on her table. You can't blame it on Jose, who has a part-time job and he picks up 2 more just to support himself and his son. You can't blame it on Maria, who's worked and invested in Social Security her entire life, but she's on a fixed income and has to worry about how to put food on her table and how to afford her prescription drugs. And so when I talk about us, these are the people that we're serving. These are our neighbors. These are our family. These are our people, okay? And so the narrative that I talk about is them versus us. And sometimes as providers, as food producers, there's this divide that happens. And when we talk about community, there has to be a closing of that gap and that chasm so that we get rerouted to why we even started this in the first place. And so in that framework, I talked about 3 opportunities to change the narrative. One is to look upstream. Look at why are you doing this? In food banking, I was like, wow, we're feeding people. This is great. But I realized in feeding people that we were feeding them sugary cereal, canned goods full of sodium, and sometimes near expired food. Where's the dignity in that? I realized that it was pounds in and pounds out, putting pounds before people. And so when you look upstream and address the root cause of it, is that we've got to look upstream and see that it's not just about food. Because if we look at it and think that hunger is just about food, we're missing the bigger picture. Because hunger is a symptom of a much bigger problem, and it's poverty. It's this vicious cycle that's going over and over and over. So in your spaces of influence, whether you're from Washington or Vermont or Georgia or Milwaukee, I challenge you to look at what am I doing? And am I addressing the root cause, or am I only addressing the symptom? The second thing is to take a stand. As I mentioned with ARPA, natural disasters, there's floods of resources that usually come into our hands, right? That's the winning season for people in social services. I shouldn't smile, but it's the unfortunate truth. There unfortunately are these fiefdoms and these fights among nonprofits, whether you're in food or not, for resources. And there are a finite number of philanthropic organizations willing to give us dollars for the work that we do. What I'm saying is that it's important that we take a stand for who and what we believe in. Because in that fight for dollars, there are a number of nonprofit organizations participating in mission drift to chase the dollar and missing the mark on making a real impact with the communities that we serve. And last thing to consider is to work in concert. Like I mentioned, that food and hunger is not just about food, it's about the system. So if I work in food, right, I work in the food thing and I put my puzzle piece down, I look at the bigger picture. And then if you work in housing and you put your puzzle piece down, and you work in employment, you work in education, you work in healthcare, we all are coming together to solve this issue of poverty, doing our thing really well, doing our own thing really well. We're able to step back and see how collectively we're able to make a much bigger, clearer picture and move the needle faster. Do you get that? Mm-hmm. And so I want to do a quick exercise in the last bit of time that I have. And at your table, you'll have sticky notes and pins. I'm going to ask a series of 5 questions, and I want you to think through the work that you do in your local communities. I want you to write down, take one by one and write down the question. You're going to do one question at a time, and I want you to turn to the neighbor and put their chair. The first question is, what is the narrative? Like in the space of insecurity, in the face of hunger, the narrative is them versus us. Why can't they pick themselves up by their bootstraps? What is the narrative in the gleaning world? What narrative are you up against?
They say it's going to definitely be on here because they want to get us. So I'm just aware of that.
Yeah. I wrote that. Don't want to put, it's a process.
Like for the it's in the confidential
Yeah.
stuff.
This
Yeah.
is here.
Yeah.
Like maybe you stop.
There could be a problem.
Yeah.
It's not.
Yeah.
What's the narrative?
We. In our town, our food bank was directly next to a local grocery store, and it's, locally owned, and they do a great job, and we buy a lot of the produce that we use, eggs and milk and, and necessities for the food bank, but we used to do grocery rescue from them. And now we don't, because one of the things is because they felt that they were in competition with us for customers. So I think we're against that. I mean, everyone here, I'm sure, is in the narrative of, you know, trying to go against the fact that people feel that they need to be able to afford to eat rather than it being a human basic right and need. So kind of trying to supply that need in a way that's either affordable, free, giving it away. You know, we need to be going against this capital X idea that you have to be able to work hard to be able to feed your family, when in reality, it's a human right.
She said everyone, do you share that narrative? Is that a shared experience? Was there another narrative you'd like to share?
We have 3 different ideas, but I'll just share mine. We work with 62 million gardeners, and ours was simply the solution to hunger's in your backyard.
It's not a food issue, it's a logistics issue. Any other narrative? And what community are you from?
You ask me?
Yes.
I'm from North Jersey, but I'm from the organization Sandbar Harvest.org, so we work nationwide.
And the woman in the front who just shared?
I'm from Leavenworth, Washington, from Upper Valley End.
Thank you for sharing. So now I'd like you to think about what unwavering commitments have you made to your community? Have you made a commitment? Think about it and write it down. You don't have to parachute, just think about it and write it down. And I'll ask a couple people to share. What kind of commitments have you made?
Sunday night.
Speaking for myself. That's local computer.
Brina, maybe you want to ask if anybody online wants to put anything in the chat, you'd be welcome to put your answers in the chat. I'm telling them they could put their answers in the chat. Yes.
Let's take 5 more seconds. You kind of jot down what your answers are. In 5, 4, 3, 2, 1. So whether we declared it or not in public, we're all making agreements. Would you agree? We just agree. And when I say, what commitments, what unwavering is the operative word? What unwavering commitments have you made to the community? Like Feeding America likes to say, together we can solve hunger. That commitment, spoken and unspoken, is that all of us will work together to solve this problem. What are some commitments that you've made to your community?
Volunteers about reconnecting, helping you reconnect with what your volunteers. So the idea is you are being educated and you have opportunities. Get involved.
Where are you from? Colorado. Can I kind of generate and recreate what I'm hearing? Is that your unwavering commitment is to ensure that people through service learning, through experience, are educated and informed on the system, what's happening, and by being in it, by experiencing it, you can also become a champion for the cause. And hopefully be a part of that change. Are there any other commitments that you've made in your communities?
So I represent the campus food pantry for the University of Southern Maine, and we serve faculty, students, and staff. And our commitment is really just to be as low barrier as possible. We don't have any limits on how much food people can take, or how often they can come. Recognizing that some people are supporting families, and other people might just be themselves, and everyone's needs are very different. We don't really require paperwork or anything other than just. So being low barrier.
Education, Colorado, low barrier, Maine. Any other commitments?
So we as an organization, when we make any sort of decisions about the programs we're going to build, run it through this filter of providing healthier food to people in need, builds healthier communities. So it's overarching. It's at the beginning of where food comes from, all the way to whom it's delivered and how it's delivered and how it's provided and how all of those connections are then made between those points.
Those commitments are pretty clear back here.
We're struggling a little bit with the idea of it being unwavering because of the nature of nonprofits and the challenges that come about. And so I'm thinking like our unwavering commitment is to try what we feel is necessary at that time. We kept having to adjust with COVID, with trying to evaluate our programs. And thankfully, local university does evaluation for us, so we see like, is this working? Is it not working? So if we were to say like, I'm unwaveringly going to do this, it could possibly be to our own detriment because that's not working, and you're sticking to it because you so doggedly committed to this idea. So like committing to trying and adjusting. You know,
So I'm so glad that you brought that up because my next question is at what point do you waver? Your commitment is to feeding the most vulnerable. Your commitment is to educating. Your commitment is to serving a particular type of food that is most nutritious. But at what point does that not become popular? When you have enough resources?
I think part of the struggle with there is that cycle. But I think that personally, what I see, is yes, the what if you actually you can see it skipping maybe you want, but it's hard to really say if you don't necessarily support to really test it. I don't know that feels well.
That makes sense. So Denver, no, I don't want to say Colorado. What is your name? Dave. Dave said that people begin to waver people waver when they don't have resources. It's a part of the nonprofit survival toolkit, right? And then Dave mentioned that if you have the resources, then you can continue doing the good work, and you have to figure out how to constantly have the resources. So this next question is, what non-gleaning organizations do you collaborate with in your communities? And before you answer this, I want you to consider how many of you collaborate with your donors or your philanthropic communities. So as you said, you know, offer dollars for us to pilot instead of you foundation telling me what to do. Why not be open to allowing us to experience new things?
I was meeting with a grant school. Said maybe people should just give me access.
That sounds like pick yourself up by your bootstraps if there ever was any. So to that point, what non-gleaning organizations do you collaborate with in your communities?
There's also a comment there from someone from.
Is it SLO Bank or SLO?
San Luis Obispo. Yeah. It's in San Luis Obispo. It's in California. So
That's a good thing. We have a commitment. We have a commitment to providing nutritious food to our food insecure neighbors through our more rigid nutrition guidelines. Okay, that is their commitment. So the exercise here is for you to write down what non-gleaning organizations do you collaborate with in your communities.
You find you just.
Whatever you want it to be.
No, that's a great distinction. So basically what I'm asking, outside of your organization, do you partner with any other organizations? And if so, what does that look like? And even more so, do you partner with any organizations outside of your industry?
I think within our industry, we have to collaborate with these soup kitchens, food pantries, our receiving agencies. I work with that, and there's just, yes, I think in terms of pivoting and being flexible, we try to collect as much information, listen to the clients we're serving, to the agencies that we're serving, help us, figure out how we can break things, we need to pivot, be flexible, provide alternatives.
Where are you from? Atlanta, Georgia. Yes.
I would add, our program couldn't function if we didn't collaborate with other organizations. We're truly reliant on, first of all, our farmers markets where we glean from. They're essential to the work that we do. I would add volunteers in here also, that it's not just organizations, but it's also individuals who step up to say, I have time to help connect these dots. And then, of course, ensuring that the food is actually getting to people who are ready and excited to eat it, and making sure to seek that feedback. You need to have those relationships in order to understand if if the work that you're doing is having the impact you intend.
I like that part. You have to check in to see if what you're inspecting what you're expecting.
I also am saying this with my director behind farms and food producers. They're nonprofits that, we couldn't do what we do without them. And then in addition to that stakeholder, we also have a Salvation Farms serves as the backbone for the Vermont Cleaning Collective. So we're working collective impacts with partners that also do other things. So it's been really important to us to sort of expand our engagement with organizations that work with food in a broader sense than living in service.
We have several other hands up. You know what I'm gonna do? Is I have 5 minutes and Kathy does not play with me, okay? What we're going to do is I'd rather hear the shares from around the room, and what I want you to note down is just continue letting this idea percolate with, are we looking upstream, and what does that look like for the work that we do? And I'd also like you to note down for yourself is what's missing from your movement? What's missing from this movement? What's missing from what you're doing in your respective communities and as a united front? And so who else wanted to share a question?
So I'll do 3 and 4.
Okay.
And we are just coming out of advocacy season, legislative agenda in Washington State. We partner with an anti-poverty group to develop a combined legislative agenda for anti-hunger and anti-poverty. And so both groups collaborate to come up with that agenda, and then we work together to advocate on behalf of both sides of that agenda. So it's finding new partners and then also looking upstream. So not just advocating for hunger relief work, but what are some of the anti-poverty measures that are going to move the needle to then unburden that hunger relief work that we're doing. And we just came out of a fantastic legislative session in our state.
I think that's a great example of partnering with organizations outside of your wheelhouse.
Right.
What are some of the wins, or what are some of the successes or benefits that you've experienced from doing that?
One of the big ones is college hunger. So partnering with folks on the education side to create ambassadors and trailblazers within college campuses, primarily like community college campuses, to provide information about services that are available, where they can get resources and other things to prevent them from then needing to have an on-college or on-campus food bank, something along those lines. So getting the services, getting people connected to services before they have to turn to a food bank.
We have time for one more question and it's only 2 minutes.
My name's Kara, I'm from Southern Vermont and Rachel's table. And one of the things that I find to be missing a lot is understanding how trauma impacts people in relation to food insecurity and the barrier, the psychological, spiritual, emotional barriers that many people face when it comes to an opportunity to grow food, right? The difference between an opportunity and an outcome, that you may have an opportunity to participate in a community garden, but you may be carrying a lot of lineage violence related to food that prevents you from having that basic option. So that's one of my bigger commitments personally, is contributing to what we're healing makes that possible for people to say yes to those opportunities that they're mental.
Thank you for sharing. You know, I have so enjoyed engaging with you today. I mean, the work that you're doing across the country is really, really, as my son would say, magnanimous. He's up and he loves using the word Google. You guys are Google. I want to thank you for sharing, and I have to go, but I encourage the same rhythm of sharing your best practices, because you're absolutely right. I think even when you think of trauma, not from a place of having the land and gleaning and being in the space, being able to heal, but thinking about the end user experiencing trauma, is that if you experience trauma, it affects your ability to digest and actually consume food. So thinking about how the work you do and the individuals that you're serving, how it's impacted. So again, Raina Andrews, Healthy Food Movement. We talked about food systems, food and community. Thank you so much for your time.
Thank you so much. Thank you, Raina. Thanks everyone. I have a few announcements before our next presentation. First, I have this water bottle that was left at yoga. Your water bottle. Thanks.